Good evening, good morning, and welcome wherever you are. I'm Carolyn Dinshaw, Dean for the Humanities in the Faculty of Arts and Science at New York University, and I'm delighted to open our presentation tonight, the panel On the Front Lines, Filipino, Filipinx healthcare workers. Our event is sponsored by a number of units at NYU, including SULO, the Philippine Studies Initiative, the Rory Meyers College of Nursing, the Robert F. Wagner Graduate School of Public Service, the Office of Global Inclusion, Diversity, and Strategic Innovation, and the Asian Pacific American Institute. In addition to the New York Southeast Asia Network, we thank all our sponsors for their support. There couldn't be a more timely or urgent event given the circumstances of the last 15 months. And I know everyone is eager to hear the panel. But I want to take just a moment to tell you a bit about SULO, the Philippine Studies Initiative here at NYU, and then I'll hand it over to our moderator for the evening. Our event tonight is in fact part of the official launch activities of SULO. The initiative is brand new. It has started with seed funding from Deputy Speaker and Representative Lauren Legarda of the House of Representatives in the Philippine Congress. Deputy Speaker Legarda, believing that the needs of the increasing number of Filipino immigrants need to be addressed, was interested in the possibilities of developing a Philippine studies program at NYU. With our interdisciplinary approach and global footprint, NYU is ideally suited to the task. With brilliant faculty, students, and staff from across the university, we convened a steering committee to envision both curricular and extracurricular investigations of Philippine culture and history, exploring linkages between Southeast Asia and the Asian Pacific and beyond. Also links between Latin America and the Philippines, and between Europe and the Philippines as well, a whole global network. The result of the seed funding is SULO, which I'm told is Tagalog for torch. That's an elegant translation of NYU's iconic torch symbol to this new enterprise. Already, SULO sponsors a graduate student group, research and travel grants for undergraduates and graduate students, a film series, and has just held a virtual world premiere featured in the New York Times of a play by steering committee member Luis Francia. SULO doesn't yet have its own curriculum, nor does the steering committee oversee an academic program or degree yet, but individual faculty members are actively involved in teaching classes related to the Philippines, incorporating content in their courses that relate to the Philippines and Filipinx studies, and a course proposal is being currently drafted, so please stay tuned. If you'd like more information, please visit the website at http://wp.nyu.edu/spsi, SULO, the Philippine Studies Initiative. And I believe that's going to be put in the chat as well. Thank you very much for being here. And now I'll turn things over to John Gershman, our moderator for the event.
Thank you so much. Excuse me. Thank you so much, Carolyn, and very excited to have everyone here. I assume that this is not people's first webinar, but just to remind people in case, excuse me, to please put your questions over the course of the webinar in the Q&A bucket, and we will feed them to the panelists after their presentations. It's my pleasure to introduce the very first panelist. Emerson Ea is the Assistant Dean and a Clinical Associate Professor at NYU Rory Meyers College of Nursing. His scholarship covers nursing education and innovation, immigrant health and well-being, and cardiovascular health. He is the Education Chair of the Philippine Nurses Association of America. He earned a PhD in nursing from Duquesne University, a Doctor of Nursing Practice from Case Western Reserve, an MS in Adult Health from Long Island University, and a BSN from the University of La Salle in the Philippines. And so without further ado, Emerson.
Thank you so much, John. I'm gonna share my screen, so give me a few seconds to do that. Okay, are you able to hear me okay? I know I just want to make sure that you can hear the information I'm going to share with you. Well, first of all, I'd like to thank the organizers for the invite to be part of this dialogue, to really attempt to make sense of the shocking statistic that you read at the outset of this webinar, right? 31% or a third of nurse deaths from COVID-19 here in the US are Filipino nurses. So we will try to make sense of that later on if we can. And I'd like to share some insights with you as well to unpacking this information. I really look forward to hearing your thoughts and questions later on during the Q&A, as I will be posing questions myself while we're in this current state. This is a very fitting time to have this conversation as well as we celebrate Nurses Month. May is Nurses Month, and this is also Asian American Pacific Island Heritage Month during the Year of the Nurse and the International Year of Health and Care Workers. But before I unpack the statistic that you see right there on the screen, I'd like to provide you a brief historical perspective of why the Philippines has been the major source country of immigrant nurses in the United States. It all started as far back during the time when the US colonized the Philippines in 1898, when nursing education was established in the Philippines and patterned after the American nursing education. Catherine Sinisa Choi, the author of the book, Empire of Care, the cover of which you see on your screen, argued that this created preconditions that facilitated the migration of Filipino nurses to the United States. The first big wave of Filipino nurses coming to the United States started in the late 1940s and early 1950s through the Exchange Visitors Program, designed to offer education and practice training to internationally educated nurses. So nurses coming from the Philippines, not just the Philippines, but countries Europe. These nurses are expected to return to their countries of origin at the end of their contracts to enrich their profession in the Many did, but others did not and stayed here in the US. The enactment of the Immigration Act of 1965 that encouraged the immigration of skilled workers to the US became the inflection point that led to the rapid rise in the number of immigrant nurses coming from the Philippines. Since then, Filipino immigrant nurses have been an integral presence in the US healthcare system to help mitigate the cyclical nursing workforce shortages, especially during times of health needs, such as the AIDS epidemic in the 1980s and early 1990s. Briefly about the demographic profile of Filipino immigrant nurses. Compared to the overall US nursing workforce, more Filipino nurses are prepared at the baccalaureate level, which is expected as BSN is required for practice in the Philippines. They work full-time and employed in the hospital settings, particularly in the areas of critical care and medical surgical units. They make up 4.5% of the total nursing workforce. That's about 150,000. This number may seem small or even negligible and irrelevant, but the picture changes when you examine closely where Filipino nurses work and live. An example, in California, 20% or 1 in 5 registered nurses identify as Filipino. In the New York, New Jersey area, our current location, 1 in 4 Filipinos work in healthcare, where a significant number are registered nurses. Other than California, New York, and New Jersey, many of these Filipino nurses settled in Texas, Illinois, and Florida. Now to the meat of this conversation. There are so many factors that would have contributed to this, and we would like to learn more about them, but I'd like to focus on 2 potential factors. First one, a significant number of Filipino registered nurses work in acute and critical care units, such as emergency room and intensive care unit, which may place them directly exposed and vulnerable to the effects of the novel coronavirus. Second point, as a population, Filipinos have disproportionate rates of comorbidities such as hypertension, and diabetes compared to other Asian American subgroups, conditions that have been identified as significant risk factors associated with the severity of COVID-19 symptoms, including deaths. Many of these Filipino registered nurses may be burdened by these chronic disease states. But I'd like to dig deeper into unpacking these states, these conditions in particular, the two conditions and potential conditions that I shared with you. I'd like to unpack the first point, which really point to the experiences of Filipino nurses at the bedside, especially at the beginning of this pandemic. What support did they have? Who advocated for them serving on the front line? Who spoke up for them? Were those voices loud enough? One interesting information is that many of the Filipino nurses do not further education when they settle here in the United States. And this is a statistic I can share with you. Only 8% of Filipino nurses have master's degree or higher, compared to 20% of white nurses and 15% of Black nurses. It would be very interesting to find out more why many of them do not continue to further their education. Is it a choice? Yes, it is a choice, but maybe they don't have any choice. Because as we know, higher education means more opportunities, including leadership opportunities, and having a leadership role means having a voice in the discussion. Representation matters. Now, unpacking the second potential factor, I'd like to provide some insight on Filipinos' health status. I'd like to share a slide with you to give you a visual representation of the disparities, of the health disparities that afflict the Filipino population. So what do you see on the slide are data from the California Health Interview Survey of 3 groups being compared in 5 health outcomes. Whites are represented in the dark colored bar, Asian American as an aggregate are in the gray bar in the middle, and Filipino Americans in the yellow bar. So as you can see in all 5 health indicators, obesity or overweight, hypertension, heart disease, diabetes, and asthma, the yellow bar sticks out. But when you just look at the 2 groups, whites versus Asian Americans as a group, that disparity may not be that very, very obvious, or they might not even be a disparity. So it's very important to really point this out, because when you disaggregate the data, it really shows that there is disparity, health disparity in the Filipino American community. This data is from California, but the health status landscape among Filipino Americans from limited national data do not change and consistently point and suggest health disparities in hypertension, diabetes, and cancer. As I've alluded to earlier, many nurses may be burdened by these chronic conditions. I am sure now you see the irony here. Filipino health workers, especially Filipino RNs, are essential parts of the American healthcare system. Yet it appears that they do not have their own health needs addressed. Health disparities like this do not happen in a vacuum. And what are the intrinsic and extrinsic factors that contribute to this? The word chronic takes on a different meaning here for these Filipino nurses who had been living and working in the front lines as an immigrant nurse. These experiences are very different also from the model minority mythology that is associated with the Asian Americans. COVID-19 has focused the spotlight on this group of nurses who may not like the spotlight, but they have no choice. As a group, they have been in the spotlight before when people question the hiring of immigrant nurses, including those who fear that they will steal work and opportunities from the native born. And the most concerning ones are those who question their quality of work and view their care as unsafe. These nurses are risking their lives every day to ensure patient safety, and many have paid the ultimate sacrifice. COVID-19 and its impact on Filipino RNs has also posed a question about the system and structure within nursing and healthcare and our society in general that may be at play here. These concerns and issues are all too familiar now to us as we dig deeper into the root causes of why things are the way they are. There are so many questions to answer. Here are some of mine. How do we ensure that students know about the contribution of immigrants in general, not just immigrant healthcare workers? I am so glad that Sulu is taking this lead at NYU to really share information about this immigrant group, the Filipino group. The other question that I have is, how do we ensure that our conversation about diversity, inclusivity, and belonging in nursing and healthcare truly include other groups? There is a question also of the mental and emotional health sequela of this pandemic to this population and healthcare workers in general. There is data indicating that 93% of all healthcare workers are experiencing stress and 76% are experiencing burnout and exhaustion. So this is a bigger problem that we will be experiencing and people are anticipating to experience in the future. So what about the hiring of immigrant nurses? Will it intensify? Because that's what happened in the past when we have urgent medical needs here in the US, such as the AIDS epidemic in the 80s, where they called on Filipino RNs to help. The International Council of Nurses estimates a global shortfall of more than 10 million nurses by year 2030. And that does not take into account the effect of COVID-19. New projection actually from the International Council of Nurses put it at 14 million, with nurses retiring, with people leaving their workforce, and this is at a global level because of the pandemic. What about the pandemic's impact among Filipinos who consider nursing as a career choice? And I ask this question especially among second-generation Filipino Americans. I know many of them take up nursing because of the role models in their family or community. Would a career in healthcare still be the first choice? Filipinos are overrepresented in healthcare, who make up 16% of the total immigrant healthcare workforce in this country. And I'm so glad that we have someone here from the Philippines who could give us perspective of how healthcare workers, including nurses, are experiencing and managing COVID-19 in the Philippines. There are more questions than answers here, but this has also been a time of reckoning for the Filipino registered nurses group. Do we continue to be quiet and go with the flow? Or do we tell our own story instead of others doing it for us? It may be uncomfortable, but we realize that we need to do this in order not to be forgotten and erased. The picture that you see on the right side of your screen can be found on a website called Kanlungan, which means sanctuary or resting place, and serves as a virtual reminder of the Filipinos who have died from COVID-19, to remind us that behind those statistics, labor percentage, or an immigration number, are people who are trying to take care of you and myself and to help us survive this pandemic. I really, really appreciate this opportunity to share with you some of the insights I have about this problem, this issue that we are confronting right now. Thank you so much. Salamat and mabuhay.
Thank you so much, Emerson. So we're now going to move to our second speaker. Kym Villamer is a clinical nurse manager at New York Presbyterian Hospital. She's a certified medical surgical RN, received her BSN from the Universidad de Santa Isabel, and is currently a dual degree master's student at CUNY in nursing administration and urban policy and leadership. So being a counterexample to the point that Emerson was making earlier about nurses not continuing their education and getting master's degree, and Kym is an exemplar of the other path.
Thank you, John, by the way, and thanks everyone for inviting me over. It's a great honor to be here, to be able to speak about our story, especially mine. I've decided to make this presentation personal because I'd like everyone, I know we haven't traveled in a while, and I'd like your minds to travel with me as I trace my roots, as I trace the roots of a lot of the Filipinos that are already here, and hopefully I could capture the story of those who perished as well. My goal for this talk is really to bewilder everyone, because it's important to know the facts, but at the same time, the studies are still ongoing. And we have a lot of layers to unpack. And I really appreciate the talk that Emerson gave, because it really complements whatever it is that I will be telling as we move along. So let's talk about the Filipino culture. You can go to the next slide, please. We can go to the next slide, please.
There was a momentary technical glitch. Hold on. Here we go.
No problem. Okay, so let's travel to a rural area in the Philippines. And for a family in a neighborhood would like to change zip codes. So what you would do in New York, if you'd like to change zip codes, you call a real estate broker and you view apartments. But in the rural areas in the Philippines, when someone is intending to change their zip codes, or at least change their location of residence, and they live in a hut, and it's possible to move that hut from one place to another, they call on their neighbors, who actually eventually volunteer, about 15 to 20 of them, to actually move the house itself. And so you'll see a community of people lifting the hut together in unison and helping a neighbor move. There is no payment for this, but a lot of times, even with the scarcity of resources, the family is still able to serve food on the table and feed the residents and the neighbors who actually help them transfer their hut from one place to another. And this beautiful thing is an important piece of our culture, and it's called bayanihan. Next slide, please. And we've seen bayanihan in many versions, and we have a modern day version of bayanihan, which is now called the community pantry, which was started by a young lady called, her name is Anna Patricia Non, and she decided that she's going to do something about the hunger that's being experienced by our jobless fellow men in the country. She decided to put up this little cart and fill it with vegetables, whatever she can, filled it with canned goods, just for people to be able to take from it, with the sign, take what you need and give what you can. And it's been sustainable. It's been widely received by people, and now we have about 300 of those community pantries all over the Philippines. And it has really empowered a lot of people to actually share what they can. And so this is bayanihan for you, and this is the Filipino culture for you. But then this bayanihan also is a piece of us that we take with us wherever we go in the country. And unfortunately, those 83 Filipino registered nurses have died living out the spirit of bayanihan, to be there for the community they swore to protect. Next, please. And so let's talk about the journey of a nurse. Put yourself in a situation, wherever school you would like to be, anywhere you go in the Philippines. If you go to a nursing school, you're signing up for no social life. Well, I did have some social life, but it's basically a 4-year course, which is from Monday to Sunday. I did have half a day as a break, and then Monday I had to basically go to school at 7 a.m. It's a very rigorous course. It's also an expensive program, especially in the Philippines. Here we do have associate's degree, but in the Philippines, it's strictly BSN. And it's an expensive program because basically, for example, if you're working as an RN in the Philippines, you're earning 13,000 pesos. That's your take home, which is about 300 something. It's not even $300. That's monthly. That's your monthly pay. And if you're going to send your kid to nursing school, you have to pay, for example, in the province, especially in my school, we used to pay about 35,000 pesos, which is about $700 per semester. Plus you have to get books, plus you have to pay your uniform, because in the Philippines we actually wear uniforms, so you have to pay for everything else. So the problem here is that there are no student loans there. You actually have to, it's either you loan from your neighbor, or if you're fortunate enough to have a friend or a relative, or if your parents are OFWs, at least you're able to actually send yourself to school. And also, it's a very competitive course. I remember during my time, we started with 8 sections, and one section is composed of 40 students in one class. And we graduated with 4 sections, because either some people just shifted to another course, or some people just decided that actually a lot of them actually failed the course. So it's a very competitive course, which speaks to you about the quality of the graduates in the Philippines. And plus you have to take the board exam, which is the nursing licensure examination. So not all of the people who graduate from nursing school get to pass the exam as well. So it's very, very filtered out. And then, of course, I have already had my registration, my license. Of course, I need experience. Unfortunately, when you graduate, you have the option of whether applying for a hospital that will compensate you, or a lot of times you go for volunteer work. What's very sad about the volunteer work, which a lot of my batchmates had to go through, is that you don't get paid for it, for the service that you give, and this is full time that you're doing this. You have to pay for your continuing education units, which is actually a requirement for you to continue, or for you to renew your license. And you have to take these courses during your vacation leaves. So that in itself is not very, it's not very encouraging to hear. And of course, with this particular situation that you have, it sort of, there's an element of desperation to get out of this particular situation, because you know for yourself you will find it very hard to support a family with the circumstances you're faced. And that's the time you think of, I need to go abroad. I need to find a place that values my worth.
Oh, sorry, folks. I think we had a momentary technical glitch. We'll see if Kym can get back on relatively quickly. But she seems to have, there she is.
I think I was disconnected.
Yep.
I'm so sorry about that.
No problem. This is the Zoom world we live in.
Thank you. Okay, so I was talking about the examinations, right? That's where I got to, right?
Mm-hmm.
Okay. So, they pay hundreds of dollars also for examinations for them to be able to qualify for spots abroad, because when the employers here are looking for experience and at least 2 years of experience, most probably that's their requirement. So everything works out. I borrow me from, or I get, my mom sells my lot, our lot, or my mom sells, I don't know, wherever she gets her money from. But eventually, finally, I fly to the US. Let's go to the American dream. Next slide, please. Of course, when you've spent this much money, you are going to look for an ROI. You have to pay off your debts, the money that you've loaned from your uncle, from your neighbor, or if you're fortunate enough, you also, you don't have to pay anything. But a lot of times that is the situation. So you become somehow naturally, if you're first generation, you sort of assume to be the breadwinner. And there is a pressure for you to work hard, so that you're able to earn enough. And you have the susceptibility to take more overtime shifts, right? So I hope everybody kind of is following where I'm going with here. So you also become the brave overseas Filipino worker. Um, so you're going to the US and you start off alone, and sometimes you have roommates, or you have to live with a family friend of while you're sort of settling in the new country that you're in. And also you have extended families too. You get to have cousins around. But then there will be a lot of moments where you check your Facebook Messenger, and your very, very, very distant cousin is asking or soliciting financial help from you. And that happens a lot with us. And somehow, when you have a little bit more, you start to offer to pay tuition fee for cousins of cousins, and you start being able to help a little bit more. And of course, the balikbayan boxes. The balikbayan boxes are are care packages. Basically, it's huge. And when I was growing up without my parents, because they have to come here, that is actually their way of compensating for their absence. So I get a lot of good stuff from that balikbayan box. I get my shoes from there, I get chocolates, I get whatever it is that I want my parents to buy for me. So that's what I get from the balikbayan boxes. So that actually makes us happy when we shop for the people we love and pack them up and send them home. And of course, family migration. Of course, when you come here, eventually you want to be with your family. So with immigration policies, you're sort of forced to stay a certain number of years for you to establish your for your residency or citizenship, and eventually for you to be able to tag your family along with you. So that's actually like the culmination of everything. That's the time when you feel like, oh my gosh, this is a dream come true for me. My family's here, I have a stable job, I'm an RN, so everything is gonna be all right. Next slide, please. So now I go to the workplace. Of course, there's still the breadwinner mentality. If you're going to take your family here, you have to set up roots. You have to be able to afford the lifestyle here. So a lot of times, when you're in this situation, and this is actually real because a lot of us take up overtime shifts because we have investments in the Philippines, or because our 5 kids are going to college, or there's just a lot more that we are responsible for. And of course, with the caliber of the nurses that we produce in the Philippines, the nurses that we produce are resilient, they have great work ethic, they're hardworking and very smart. And of course, when you have those qualities, they trust you to be with really complicated cases at work. You go to specialty units. You are actually you're living it up. So basically, you are a model RN. A lot of times that is the case. And of course, you bring your Bayanihan spirit in and out of the hospital. That's why we have a lot of Filipino communities here and there, because we have to find our community here. And you practice it at work and outside as well. Sometimes just a side comment, I used to get called out at work before, because when I see a Filipino, we start talking in Tagalog. We get so excited to see our fellow Filipinos at work, and that's the time we just start. Okay, we have to watch ourselves. We have to speak English again. But anyway, and also the health risks. This is a study from Stanford Medicine that we are really predisposed to cardiovascular disease, diabetes, and asthma. So let's go to the next slide. I want you to think about everything that I've told you and what you think about the reason, I want you to think more about the experiences of the nurses, of the Filipino nurses, just to get here, and what kind of experiences that drove them to make the choices that they made, just to be able to serve a country that has received them with open arms. And as we speak, there are still so many nurses from the Philippines who are still wanting to come here, despite the circumstances. And even during the crisis, a lot of my friends, a lot of people were willing to move into the crisis because it's the American dream. All that bravery, all that courage, and that determination to just be in America, to provide a better life for their families, to risk their lives to be able to serve. There's so many layers to it, and unfortunately, we have lost our titos and titas, our ates and kuyas in this war. And hopefully, as we share this journey, we open the eyes of society to take a closer look at failure of systems, its failure of systems, and how the pandemic has really emphasized the fact that we have layers of issues which can cause really terrible consequences. But let us continue to have these conversations, because I believe that this one conversation is a part of a huge scheme, of a larger scheme of life-saving measures, so that we don't lose more titos and titas, ates and kuyas. And thank you for your interest. Thank you for putting the spotlight on us and helping us find a solution to this. And this is not the end. This is just the beginning. Thank you.
Thank you so much, Kym. And we're going to move now to our next speaker. Maria Paz Carlos is a Senior Public Health Advisor at the Health Resources and Services Administration at the Department of Health and Human Services. She has a Doctor of Vet Medicine from the University of the Philippines, an MBA from Georgetown, and a PhD from the UC Davis School of Medicine.
Thank you. Thank you for the opportunity for having me here, and I'm very much humbled. Thank you, Kym, for sharing your story about your journey, your nursing journey to all of us. So I'm going to shift gears and talk about some of the programs that we have in the federal government. Is there a way for me to share my screen?
Yep, you can just go ahead and share your screen.
Wonderful. So that's what was mentioned earlier. So I do work for HRSA. It's the Health Resources Services Administration. It's one of the agencies for the Department of Health and Human Services. And just wanted to give you some overview about our agency. It supports about 90 programs that provide healthcare to people who are geographically isolated, economically and medically challenged. And we do provide grants and cooperative agreements. There's about $12,000 million in funding that support primary health care. So if you've heard about the federally qualified health centers, most of those are funded through HRSA. I've met several Filipino nurses actually working at the health centers. We also provide scholarships for nurses as well under the Health Workforce Program. It's about 1,679 million of funding. As part of the COVID response, HERS has awarded more than $2.5 billion through grants and other funding mechanism, and this through expanding the capacity to prevent, provide PPE and so forth, and diagnosis and treat COVID-19, increase access to telehealth, and supporting and expanding our telehealth services, and training for healthcare providers, including our nurses. There is the Provider Relief Fund, an uninsured program, which has also covered a number of our Filipino community and also the Asian American Pacific Islanders. Here's an overview of our health center program. So about nearly 30 million people, or 1 in 11, rely on a HRSA-funded health center in New York City alone. During my tenure there was about more than 40 FQHCs, and it's serving about 1 in 8 children, 1 in 5 rural residents, and 1 in 3 people living in poverty, and 1 in 5 uninsured. We also support the HIV/AIDS program, the Ryan White program. And we also provide funding to our maternal and child health, child population and their families. About 92% of pregnant women have been served, 98% of all infants, and 60% of all children, including those with special healthcare needs. Some of our Filipino nurses are actually working in the maternal, infant, and early childhood home visiting program. And that's a program well funded by HRSA from the time women are actually pregnant and until the young children go to kindergarten. As I mentioned earlier, there's a huge health workforce program connecting skilled healthcare providers to communities in need through grants, loan repayments, and scholarships. And this is not only limited to nurses, but also to physicians, other healthcare providers, including physical therapists, OTs. And this program strengthens the health workforce through more than 40 other programs and initiatives that support thousands of organizations. I just want to put in a little plug for the National Health Service Corps and Nurses Corps. This actually supports scholarships and loan repayments for more than 17,700 clinicians, and they're mostly nurses. Nurses currently supports licensed RNs, nursing students, and nurse faculty. And the National Health Service Corps and Nurse Corps provide care to more than 18 million people nationwide in rural and other high-need areas. So I just want to make sure I'm hearing Kym's story and our dean early on that there is this opportunity for a health workforce program that our Filipino nurses might be interested in and would like to tap on. With that, thank you for the opportunity.
And our final speaker of the panel, Gideon Lasco, has an unreliable internet connection, so he very generously recorded his presentation, which I will play.
So let me devote this presentation to share with you the experiences of healthcare workers in the Philippines. Now, the main argument that I will make in this presentation is that healthcare workers in the Philippines faced not just the medical, but also the political front lines of the pandemic response in the Philippines. Now, before I share the experiences of healthcare workers in the Philippines during the pandemic, let me offer 3 quick contexts about the Philippine healthcare system. First being that it's always been faced with long-standing inequities. Healthcare workers have long been under-resourced and underpaid, both in the public and the private sectors. we've seen the concentration of health services in urban and private settings. So even within the Philippines, there's a large amount of inequity, even as there's also this global health inequity. So even before the pandemic, we see these inequities. We see this lack of equipment, lack of PPEs, the underpaid healthcare workers, the lack of ventilators, etc. All of them have been around even before the pandemic. The second context that I want to lay down initially is that healthcare workers in the Philippines have had a long history of activism precisely because of these challenges in the healthcare system. So healthcare workers have been very vocal. I mean, not all, but some healthcare workers have been very vocal about the healthcare system. And more broadly, they have been very outspoken about how the political situation in the Philippines is very much a determinant of health. Because if we see the state violence, if we see the corruption in the health in the political realm, then of course it impacts on healthcare. And the third context, which is very relevant to this conversation, is that precisely because of these conditions, the inequity, the political difficulties, the Philippines has been a long-standing source of healthcare workers globally. Some estimates place the number of people leaving as 13,000 annually. So it's not just the US that's been a destination for healthcare workers, but the UK, Europe, Southern Europe, Singapore, the Middle East. So the Philippines is a long-standing source of healthcare workers globally to a point that some schools really cater their curricula towards people who want to work abroad. Push factors include economic, so the very low pay that people get. Uh, Starting salaries for nurses might not even reach $300 per month. And then, of course, there's the social political environment that we saw in martial law during the long martial law of Ferdinand Marcos. We saw many Filipinos go abroad, and even during the Arroyo years in the early 2000s. And now, of course, with the Duterte regime, we might expect, if not already, more people desiring to leave because of the social political environment in the country. But beyond that, there's also pull factors. People want to experience living abroad, the sense of adventurism, the desire to practice medicine in a more ideal field. So there are also pull factors, and it's noteworthy that in the early 2000s, many doctors in the Philippines even enrolled in nursing schools so that they can work not as doctors but as nurses, especially in the US. Now, when the coronavirus pandemic hit the country early last year, of course, the healthcare workers were found themselves in the medical front lines, facing the cases, facing the risk of death ahead of the population. Now, the government's response has been ambivalent. On one hand, these healthcare workers were praised by government officials, including by the president. However, it did not really translate to protection for these healthcare workers. Even as early as March, when the pandemic was starting in the Philippines, medical groups have pointed out the lack of equipment, the lack of protection for doctors, nurses, etc. And beyond that, they faced stigma from people, and there were not enough attempts to protect healthcare workers from stigma. There were even some cases of open violence, being forced away from their own apartments, etc. So healthcare workers faced stigma and discrimination. And on top of that, to link back to our conversation about the diaspora, they were prevented from working abroad. So they were effectively barred from seeking alternatives to what they were already facing. And then there were appeals to nationalism once again. So Given all of these challenges, Filipino healthcare workers had to protest, had to demand for benefits, demand for protective equipment. Now, these came to a head in August 2020 when there was a surge of cases, and many healthcare workers came together to demand for a timeout, meaning to say that they were demanding for a new quarantine with steps taken to actually control the pandemic, including mass testing, better contact tracing. And Duterte, the president, responded by agreeing to their demand, but not without this kind of divisiveness that he showed, like accusing doctors, accusing healthcare workers of being rebels, of being trying to foment revolution against him. So he took these protests personally, and we see this happening throughout the pandemic when there was finally talk of vaccination being rolled out. Healthcare workers were promised that Pfizer vaccine will be given, but only to find out days later that it was Sinovac, the Chinese-made vaccine that will be given them. And of course, many people, independent of the medical debates about the efficacy of different vaccines, of course, healthcare workers felt that they were lied to and betrayed because of this sudden change. So all of these things compound the existing challenges that healthcare workers were facing. And once again, they were forced to protest. They were forced to speak out against these these policies or and lack of evidence that informs them. And once again, instead of actually listening to these concerns, the reaction by government is to vilify them, to reject these concerns, telling them don't be choosy, just support us, just listen to the experts. So it's mostly dismissiveness that has been the response of government towards these pleas by medical frontliners. And they were even told that if you protest, if you raise any objections to this vaccination, then you will erode vaccine confidence. So it is almost like a moral and emotional blackmail against healthcare workers who eventually participated in this Sinovac vaccination. So it reflects how there's really a subordination that's happening here in which healthcare workers have very limited options in terms of what they can say, in terms of the political climate. It's very hard for them to navigate it. And until now, so today we face another surge, an even worse surge in the Philippines, worse than ever before. And once more, we see the ambivalence being showed by the national government. So once again, Duterte keeps praising the healthcare workers in his official rhetoric, even though the reality is very different. So almost during the same week as Duterte praised the healthcare workers again, it was reported that his spokesperson managed to get a hospital bed in the Philippine General Hospital at a time, even though it seemed that he only had mild COVID, at that time that people were struggling, even doctors themselves were struggling to get their family members admitted due to the lack of beds, due to the lack of ICU beds. So it really undermined. This is very hurtful to many healthcare workers, just in the same way that some politicians appeared to have tested, appeared to have easy access to testing at a time when testing was so difficult in March and April 2020 in what was called VIP testing. So these double standards are very hurtful to healthcare workers who feel that they're bearing the brunt of the pandemic response, and yet they're not being prioritized. They're not being respected even by the government. So in conclusion, I would say that healthcare workers have really borne the brunt of the pandemic. So some of my own colleagues have died because of COVID-19, and many, even today with the surge, many people are isolated because of quarantine. Many healthcare workers are getting sick. So it is an ongoing struggle. Healthcare workers have clearly borne the brunt of the pandemic in the Philippines, and they are further angered by the double standards in the pandemic response, the lack of evidence-based policies, which is something that they clearly see, knowing how to appraise these kinds of evidence. The government, unfortunately, has been ambivalent and two-faced. On one hand, it keeps praising the healthcare workers, but it's failed to protect them. And it has created a climate in which it's very difficult for doctors to protest. Unfortunately, we have yet to see public health leadership that will side with the healthcare workers. And instead, we see many of the public health figures cooperating with Duterte, or at least tolerating his divisiveness, tolerating some of the worst policies. So it's been left to grassroots healthcare workers organizations, nurses, doctors, etc., to challenge the government response. So what we have seen over the past year is that healthcare workers in the Philippines are not just in the medical front lines, they are in the political front lines as well. So thank you for listening, and I look forward to the discussion.
Thank you so much, Gideon, for that. And now I'm sure there's people have lots of questions and so forth. Gideon was so quick to respond to one by typing the answer that I worry that people might have missed it. So I'm hoping to reopen it, and of course, anyone on the panel would be welcome to respond to it. But the question comes from Lourdes, who was asking about whether the Philippine government has made any efforts to try to increase the salaries of Philippine nurses in particular, so that the incentive might be that they would stay at home, or is this an active element of kind of Philippine economic policy, which is, you know, sending healthcare workers abroad becomes a source of remittances that supports families back in the Philippines. So Gideon, I don't know if you want to recap your answer, and then we'll open it up to the rest of the panel.
Hello. Yes. Thank you for that question. It's really quite important to raise that, and I really see this question as pointing to larger systemic issues within the Philippine government. So at one point, they were contemplating, they were so open to having a kind of raise for nurses, but they realized that they have to raise the salary of everyone else, because you cannot just raise the salary of nurses without raising the salaries of the technicians, the doctors, and other people in the hospital. So they realize that they have to increase the whole salary, and they're not willing to do that. It's been piecemeal in terms of the response, and at the same time, there's no investment in the public healthcare system that will allow government to be able to support enough nurses. So it's not just really the finances; it's also the fact that there are too few nurses, so people feel overworked. So it's not really just financial, even though it's a big part of it. But I can say that a large part of the concern is also the emotional toll and the physical toll of being a healthcare worker in the Philippines.
Thank you, Gideon, for giving that perspective. So I'm gonna provide a perspective from my experiences when I immigrated, as well as what we know about the role of Filipino healthcare workers in general, Filipino registered nurses coming from the Philippines. So think about this, 10 to 11% of the Philippines' GDP are remittances, money that are being sent home by overseas foreign workers. So this is ingrained in the economy of the Philippines as well. If you remember what I said at the very beginning too, there's something to be said about the preconditions that created the system for nurses to immigrate to not just the US now, to many parts of the world as well. You have to look at the Philippine history to see that this might have been a strategy of some former leaders in the government to really make sure that remittances kept coming in. So it was ingrained. If you are familiar with the Philippine culture, healthcare workers, overseas foreign workers are called heroes. When you go back to the Philippines before the pandemic, there is a band playing welcoming you back home because you have served your country. So there is this dilemma about, yes, I'm considered a hero. I'm working a lot outside of the country. I'm treated as a hero. So that means I need to do this more. And not only that, people who see that around in the Philippines are encouraged to do the same thing because of the perception. But I guess, this is not the forum for this. We need to look deeper into the root causes of this because this is a larger picture that really spans the political, the cultural, and the historical aspects of the Philippines and sending healthcare workers, especially nurses, to other countries.
Yes. So I think it's really the circumstances, it's the situation, the work situation that the nurses are faced in the Philippines. That's really on top of many other factors, and the need to also be able to expand and to grow. A lot, there's also a factor of westernization, of globalization, and it's a really really big topic to discuss as well. So it's a combination, it's a confluence of everything. But unfortunately, they see that their efforts, the efforts that they're putting into their work, are better valued outside of the country, and that's the reason why a lot of people opt, even doctors, decide to take the NCLEX and become RNs here.
We had a question that was mentioned by a number of different speakers, and I'm wondering if people might elaborate on a little more, which is, at some point, hopefully this pandemic will, be under some level of control. And what do you see as kind of the longer term mental health legacies of the pandemic for health workers, both in the Philippines and in the US? And what type of responses might there need to be in order to provide support for frontline health workers who've physically, emotionally, mentally exhausted throughout this process? We know that mental health service targeted at healthcare workers is not great in the best of times, let alone in a pandemic. So I'm just curious if maybe you could talk a little bit about that and the kinds of things that you think are going to be necessary. Of course, many people are going through, dealing with mental health issues at the moment, but for frontline health workers in particular. And I'd throw that open to the panel as a whole.
Yeah, maybe I can respond quickly. As a medical anthropologist, I see that the humanities and the social sciences have become so important now, not just as a tool to make sense of the pandemic or even respond to it in a better way, but also, like you said, John, in terms of responding to the mental health challenges of students, of young and old practitioners. People have turned to narrative, people have turned to the humanities, but then we realize that we don't have prioritization of these subjects in the curriculum. So now is the time to really recognize the value of the humanities in the healthcare fields, and at the same time mentoring. In my experience in the Philippines, I saw how this mentoring that people have tried to build in the UP College of Medicine, for example, has really helped the young residents and the young students be able to cope with this despite the circumstances. And thirdly, I think solidarity is very important. Even though the Filipino health community is global, we don't see opportunities to actually connect with people who are working overseas. So we need to build a community of healthcare practitioners around the world so that people realize that this is a shared experience that we have. Thank you.
Any other folks on the panel like to chime in? I will say, Gideon, our Dean of Humanities, Carolyn Dinshaw, is very excited that this is also about bringing the humanities into the conversation.
I can chime in, John. I just want to focus more so on not just the individual responsibility in dealing with this pandemic. We talked a lot about resilience, right? I mean, that's the overused word, and that's the word of the moment, being resilient. And truly, that's so important trait, individual trait. But resilience right now is at a breaking point. We need to also think about the responsibilities of organizations that we work in. What is their responsibility in helping us become more resilient or to cope with all of this? The individual, the nurses have been coping, and kudos on the resilience in dealing with this pandemic. But organizations, our community organizations, the larger organization, the larger society, they have a role to play in this. It is not just falls on the individual. It is a larger issue.
I've had enough pizza for the year.
No more free pizza.
Yeah, my clothes, they barely fit. We really appreciate all the food, all the applause, and we feel the love. But there has to be something greater than that, and that is representation. We have to always remember to tap or to at least make sure that there's a nurse on the table. That they were able to actually appoint someone, which is a nurse in the COVID task force. And so we have to really continue to represent ourselves. And I know that we have been doing so many things on an everyday basis, but nurses really have to educate ourselves more so that we can have more say, because the more you know, the bigger platform you have to be able to forward policies that will advocate for your fellow men. So it's really a lot of layers, but it's more than the food, it's more than posts, it's more than that, but it's really policy and representation.
Now, I just wanted to add that we do need we're very thankful to our healthcare providers and the frontline workers. I also thank my fellow federal folks who have been in the frontline and have been in the frontline of policy. But I think we're at the point right now that we need to go beyond, as what Emerson has mentioned. It's the community has to respond, the families, all the CBOs. But at the end of the day, we need everyone together in order to sort of build or strengthen our public health infrastructure. And I do agree with Kym. I think with that representation or a seat at the table with the COVID task force or in any advocacy or policy forums would really be helpful for the nurses. Thank you.
Thank you. There was a couple of questions about vaccines, both the issue clearly of kind of global vaccine availability has been in the news, and Gideon spoke about the challenges of getting vaccines quickly to frontline healthcare workers in the Philippines. I'm wondering if any of you can talk a little bit about kind of whether in the Philippines or in the US, vaccine availability, take up, and perhaps in the global context around the global challenge of vaccine availability.
I can chime in, John, and I'm going to share my personal experience more so. I'm not familiar. I'm not entrenched with the healthcare situations per se in the Philippines. I keep watch, but my mom is there, and I keep on asking her every day, when are you going to get your vaccine? She is 80 years old. Here in the US, we know those are folks that have been the priority many months back, and they have been vaccinated. But in the Philippines, as what Gideon said, it's very different there. So this is a personal context here that I'm sharing with you, because it's different here in the US and different in other parts of the world. We are very much ahead in here with regard to vaccination, but the diaspora, the Filipino diaspora, is connected still in the homeland. We have many Filipinos around the world who are watching, monitoring, who are very worried of what's happening there, because we all have our families there. Whatever happens to them, we are still affected. And the travel limitations is starting to ease up, but there are some rules that we have to follow, and we cannot just board a plane and go home whenever we need to now because of the limitations. So I just want to make a connection that the information that we receive here and what is happening there is a gap, and but there's really not a gap. There's actually a connection with how people experience this in the Philippines and in the US.
Yeah, I would like to echo what Emerson said, that there's so much inequity in vaccine in particular. My younger brother, who's in Texas, got fully vaccinated ahead of the rest of our family, including my parents who are seniors as well in the Philippines. And the kind of vaccines that have been available in the Philippines has been, like I said in my presentation, people were at first promised that we will get the Pfizer vaccine as healthcare workers, and then suddenly it became Sinovac, which I think is a good vaccine. But then the fact that it's taking slow for vaccines to arrive means that because vaccines are more than an immunological tool, I think they're also a moral booster for a whole nation. The idea for a whole healthcare workforce, the idea that they're protected. But it's been slow to arrive in the Philippines. Although to the credit of local government, it's been good in some places. So I think we need to also give credit to the local government units, some of them who are doing a good job. But like Emerson said, the inequity is so glaring, and it's so depressing to see how it's really running differently in different parts of the world.
Well, my parents are also in the Philippines and they have not gotten their vaccines yet. My dad is 77 and my mom is 75. And obviously they're at high risk. And unfortunately, also my friends who are in the healthcare sector are not even sure if they're going to get the second dose of whatever vaccine they got. So it's very sad, but at the same time, I just want to add as like an action measure for us. We have a say. We are taxpayers here, so we can urge probably the government has an excessive vaccine. If they could actually, put Philippines on the list of those who will benefit from our excess of supplies from America, and that would be really helpful for our frontline workers in the Philippines.
Thanks so much. So this feeds directly into there was a more general question of what would be the kind of actions, particularly collective policy type actions that people could do to support whether Filipinx workers in the US or Philippine workers, health frontline workers in the Philippines. So one is clearly, ramping up support for increased supply of vaccines and availability. And both Kym, Emerson, and Maria, talked about other things in terms of, expanding representation of frontline workers, in particular nurses, and to really move the discussion away from how do we build more resilient nurses to how do we create, more environments that don't make people as vulnerable. Would there be other kind of either policies or resources that you think would be important to be directed, again, either in the Philippines or here?
I can chime in here, and there is a question actually, how can we start a petition? I mean, it is a chat. You can investigate, there is actually a push from the Filipinos here in the US to really ask the US government to send vaccines to the Philippines. I was just a meeting this Saturday, it's a Philippine Consulate General meeting in New York, and that was one of the topics. How could we help? How could we push? How could we really advocate for the Philippines so that the US can send those vaccines to the US? So investigate, for those of you who posted that question, investigate how could you really be an advocate for that, to help advocate for vaccines to be delivered from the US to the Philippines.
So there's been a broader set of discussions around vaccine apartheid, right? Including not just the Philippines, but kind of more globally, challenges to, intellectual property rights and so forth. So there's a pretty robust set of policy steps from the immediacy of making both treatment and vaccine resources available, and also in the longer term to make sure that global inequality, the pattern in access to vaccines doesn't flow along with global inequality.
John, I'd just like to add one more thing that
Sure.
I would like to make mention to everyone. If we think vaccine hesitancy is a big issue here in the US, you can hear the chatter in the Philippines, and I get so worried
Mhm.
about the information that you receive about the vaccine.
Mhm.
Gideon could talk more about this, but the misinformation,
Mhm. Mhm.
even the delay of the vaccination has kind of like contributed to that.
Mhm.
So with the availability of vaccines coming to the Philippines, would that translate to more people going to the health centers to get
Mhm.
vaccinated?
Mhm.
That remains to be seen. So, but I'm not there, and people who are there have more context into it. But I hear the chatter, even personal account from my family about what kind of a vaccine is this. This is not the vaccine that I like. This is not what I want. This is what I heard from folks. So there's a lot of that chatter and misinformation, and I think it's a really huge issue in the Philippines.
Actually, because the doctors, everybody, the frontline workers in the Philippines are quite overwhelmed, while our cases are a little bit declining. It's looking great. So we do offer our resources here. We do have doctors, and myself who are ready to create a vaccine education campaign for the Filipinos. Um, you know, we want to lessen your load. I know you're very, very busy there. So, we can offer with the Zoom world, there's a lot that we can do. And, we just have to talk and see where we can step in.
Yeah, I can join in and really say that I agree with Emerson that this vaccine hesitancy is a concern. We've seen how people who are affiliated and associated with India within the US have contributed to help shine a light on what's happening in India right now. So I think that, well, I really call upon my kababayans and my fellow Filipinos, friends of the Philippines in the US, to help shine a light on what's happening in the country. This is not just the virus; it's really a government that has failed its people, and this increased international attention will help. Not to mention the very pragmatic need for more vaccines, where we don't even know if we will get the second dose of the AstraZeneca because of all the problems in sourcing, but also the failure of the government to procure vaccines. So so this is something that we really need to work together towards. It's a global pandemic, and we really need to be in solidarity with each other.
I just wanted to say I'm a trained virologist. I'm a scientist by training. So let's follow the science and let's be evidence based. Thank you.
Great. So we appreciate everyone, both attendees and panelists, from running over time. And it's about 8:25. I just wanted to see if any of our panelists had some final closing comments that they wanted to make before we kind of wrap things up. And maybe we can go kind of in reverse order of the presentation. So Gideon, any final thoughts?
Well, I just want to really express my gratitude to NYU for inviting me to join you in this conversation. I see a lot of interest within this discussion. So this is something that we should continue with more voices in the two sides of the Pacific. So I commend the organizers and really thank you, everyone. Let's continue the conversation. Thank you.
Thanks so much. Maria.
Just wanted to say that I think we got this if we can get vaccinated and if we have access to vaccine. And again, let's follow the science. Thank you.
Great, thank you. Kym?
Thank you again for having us. This is a very important conversation. However, we will have the same conversation 10 years from now if we don't act on what we're talking about. That's the harder part, but we are in this together. If we can talk about this, we can act on this as well.
Yes, so thank you so much for this platform. And I just would like to really emphasize that conversation should come from those who experience it at the front line, specifically the Filipino nurses. And now you see how interrelated Filipinos in the US and Filipinos in the Philippines. You really cannot separate. So there's a long history, there's interconnectedness, and you've heard the story of an immigrant nurse, the challenges and the rewards, and some of the deeper questions that we need to ask ourselves moving forward, why we are in this current state, because we are just brushing through the surface of this. But thank you so much for this opportunity.
Well, thanks to all of you. I think I speak on behalf of my colleagues in the SULO, the Philippine Studies Initiative, that this will certainly not be the last conversation we have on these issues because of both its contemporary importance and future importance. And so just want to give a quick shout out of thanks again to our panelists, to my co-conspirators for organizing the panel, Luis Francia and Jordana Mendelson. A big thanks to Carolyn Dinshaw and support of the humanities program at NYU for this initiative. This is our last event of the semester, but we have a very exciting series of events coming up in the fall. And so please keep your eyes out for that. I think we've posted the link to the SULO initiative in the chat. And we have recorded the event. It'll be posted and made available if you have friends or frenemies or family members who would like to watch but weren't able to log on. So thanks everyone once again. Have a wonderful evening or a wonderful morning if you're in Manila, and may the conversation continue.